Haley Platt, and this is Portland Living. Joining me from the Dental Sleep Apnea Clinic to talk about sleep apnea, how it affects our health, and the best ways to treat it is Dr. Keith Valachi. Hi, Dr. Valachi. So nice to have you with me today.
Thank you, Haley, and thanks for having me on during Sleep Apnea Awareness Week.
Yeah, perfect timing. So let's start with a bit about sleep apnea, really what exactly it is and how common it is.
Yeah, sleep apnea is actually very common. Some estimates are that up to 25% of adults may have this. And basically what happens is when we go to sleep, our airway muscles relax, and that causes an obstruction in our airway, which can yield lots of symptoms like daytime sleepiness, mood issues, snoring, and it can also lead to multiple medical conditions, major medical conditions like high blood pressure, stroke, and heart attack.
Wow. I mean, I got to say, I didn't realize how widespread it is. That's about a quarter of adults who suffer from this. It's amazing. Okay, then let's talk about how we treat it, right? Dental sleep medicine treatment. Let's talk about kind of, what that is and the benefits that it provides to your patients.
Yeah, so the benefits of using a dental device is that it can just help people feel a lot better. We all know what a poor night's sleep can do to how we feel and operate the next day. Now, just imagine if that's going on for months or years and how miserable you can feel because of that, and then be able to get that life vitality back again.
Yeah. And I think it's not just for the sufferer of the sleep apnea, right? The partner of the person who suffers also suffers.
That's oftentimes true if snoring is one of the symptoms that's occurring. And sometimes that means that people are out of the bedroom because of something that we call sleep divorce. And sometimes we can help bring them back together again.
So, Dr. Valachi, then what is it that you find most interesting about helping people who suffer from sleep apnea?
Well, one of the most interesting things I found is how differently people respond to sleep apnea. Some people with very mild sleep apnea might feel terrible, while others with really severe sleep apnea might feel okay, but their health is at significant risk, or they might just be getting tired of getting the elbow in the ribs every night because their snoring is so loud. The other thing is I really enjoy working with my medical colleagues to bring this dental solution to a medical problem. And to that point, Haley, I have to say that dentists, we can't do this on our own. We have to have both a diagnosis and a prescription for a dental device before we can treat a patient. And oftentimes, the first treatment might be CPAP, especially if the sleep apnea is severe. And CPAP has helped millions of people. It's awesome if you can use it. But that's the issue. Some people find it difficult to use, and they may find a dental device more easy to tolerate.
So, Dr. Valachi, then what differentiates your clinic from other clinics who provide treatments?
So this is all we do here. And we also have a stronger focus on TMJ because things like jaw pain and jaw popping and headaches go hand in hand with sleep apnea.
Yeah.
And we found that some physicians sometimes are hesitant to recommend these dental devices because they're concerned they might cause TMJ, which is actually very rare. And in fact, we usually see these TMJ symptoms get better with a dental device because when that airway collapses, there tends to be this clenching or grinding event that can cause jaw pain, which is one of the symptoms of TMJ. So sometimes the sleep apnea is the root cause of the TMJ problem. So this is where medicine and dentistry converge, and we try to educate our physician and dentist colleagues about this.
Yeah, it's so fascinating, really, when you think about how everything is connected.
Yeah.
Dr. Valachi, I imagine you have a lot of success stories. Can you share a few favorites?
Yeah, a good example would be someone like Brian, who was kicked out of the bedroom by his wife because of his loud snoring. So that's that sleep divorce that we talked about. And when he used his dental device, he was able to share the room with his spouse again. And he told us that he was no longer keeping people awake when he was camping or visiting family. Or Diane, who told us that her oral appliance brought that life back to her life again, and that she now had refound the energy she'd lost so she can keep up with her grandkids again. So it just demonstrates how people's lives can be transformed with this airway therapy.
Right, and get back to living. You also co-authored a book called Silence Your Snore, Tired No More, and that can be found at silenceyoursnore.com. Chock full of information. Of course, to book a consultation or learn more, visit dentalsleepapneaclinic.com or call the number on your screen. My thanks again to Dr. Keith Valachi.
My pleasure. Thank you, Haley.